Welcome to the Aging Well podcast. I'm Jeff Armstrong here with Corbin Bruton. In this and the episodes that follow, we will share candid discussions on aging and hear from the experts. We are here to inform and encourage as we experience, aging. My guest today is an old friend and fraternity brother, Dr. Marcus Dunn. Dr. Dunn is a chiropractor in Charlotte, North Carolina, here to share his experiences and how chiropractic fits into our desire to age well. All right, so I'm here with Dr. Marcus Dunn, a chiropractor. So Mark, tell us a little bit about yourself and how you became a chiropractor.
I practice here in Charlotte, North Carolina. Been in practice for a little over 33 years. And as far as how I became a chiropractor, I like to tell people typically that, chiropractic chose me. My first trip to a chiropractor, like so many people, I woke up one morning with a stiff neck and walked into the chiropractor after my dad said to go. And he said he was going to pay for it. So being a reasonably intelligent college student, I took his advice. And when I got there, the chiropractor did an evaluation, took a good history on me and things, and said, all right, with your stiff neck, it may take us a week or two. We'll get you straightened up on that. But in the process of finding out, through what he did in his history, he found out I'd had a lot of other health problems. Primarily at that time, my biggest issue was what in today's terminology they called irritable bowel syndrome. But back in the early 80s, they hadn't made up that definite that diagnosis yet. And he explained to me kind of the big concept of how chiropractic works. He said, your brain controls how everything else in your body works. If you don't have a clear connection between the brain and the body can't work like it's supposed to. And he had found some areas in my spine that affected the gastrointestinal system. He said, do you want to see if we can get that taken care of also? And I went home and told my dad, said, yeah, I want to try this. It makes sense because I'd been doing the medical route, taking lots of different medications and really not getting any better other than just symptomatic relief short term. And took about 6 months of regular chiropractic care. That's been about 37 years ago. And in 37 years, I haven't had to take anything from my stomach since. And it was just kind of a life-changing moment for me. And conveniently, with what my major was when I was in college, it gave me the prerequisites to get into chiropractic school. So I applied and never looked back.
Awesome. So you told me a little bit about chiropractic in your first answer, but tell us a little bit more about chiropractic and how it can benefit people of all ages.
Well, as I was saying before, chiropractic operates kind of on the principle of your body is a self-healing, self-regulating organism. And the thing that controls how everything else in your body works is your brain. The way your brain connects to the rest of the body is through the nervous system. So if you don't have clear communication between the brain and the body, or from the body back up to the brain, it's not going to be able to work like it's supposed to. And because of the intimate relationship between the spine and the spinal cord and the nerves, small misalignments or areas of the spine that are not working right, which in chiropractic we call subluxations, can cause interference on those nerves. And what we look to do is find the subluxations, restore normal function to the spine and to the nervous system. And by doing that, we free it up so that your body can function at its optimum potential. And as far as how what people can benefit from, it's across the board. Most people, obviously, they come to see a chiropractor. Their first visit, much like myself, back pain, neck pain, headaches. That has, for better or worse, become the easy sell and the reason most people seek out chiropractic care. But what it's really about is getting the nervous system working right, getting the body working as healthy as possible. My youngest patient to date was 2 days old. My oldest so far is probably 95. I've had everything in between, and the benefits. Again, obviously, pain relief being the big thing, but with kids, I've seen helped out children who are having issues with ear infections, colic, bedwetting, torticollis. I've had adults with women who are having fertility issues, people with gastrointestinal stuff, asthma, just all sorts of stuff. It's really, from my perspective, chiropractic is not about treating symptoms or putting a name on whatever their symptoms are. It's about getting their body functioning the best that it can. And I do that using chiropractic adjustments.
That's great. So who should see a chiropractor and who should not?
I personally think everyone should see a chiropractor. Having said that though, the frequency that they need to get chiropractic care varies highly. Some people are high maintenance, some people are low maintenance. And it kind of depends on how messed up they were before they started getting chiropractic care and how much stress and how much damage they're doing to themselves along the way. But chiropractic care is good for people at keeping their body working the best that it can from birth to death, or before death. We're not going to see them after they've died.
You haven't raised anybody from the dead yet, have you?
Not yet. And, I don't think I'm going to try either. But with that, there are some contraindications to chiropractic care, or at least on providing chiropractic care to certain areas. If someone has a broken bone, you don't want to adjust that. If they've got cancer that is metastasized to an area, you don't want to adjust that. If they've got an infection in a joint, you don't want to work on that. So there are some things that are contraindications, and by varying techniques and being very specific on how you apply the chiropractic care, you can work on pretty much anyone, but you may just have areas of their body that you can't work on at a particular time.
You use a little bit different technique, and I know we've talked about it in the past. You introduced it to me probably a couple of years ago. What do you call that technique, and how does that differ from kind of what I think a lot of people think of chiropractic? We talk in terms of cracking the back, and really that's probably a poor terminology to use for chiropractic because it does kind of connotate damage to the spine. But a lot of us kind of are used to the more traditional manual adjustment of the spine. Mm-hmm. You use a few other techniques. Can you explain those a little bit?
Yeah, the technique that I specialize in is called activator methods. And activator it's an instrument adjusting technique. And we use a small handheld device with a rubber tip on it that delivers a measured amount of force precisely where I want it, and it puts it in very quickly. So the combination of the speed and the focus allows me to deliver the adjustment right where I want it, and to do it with less force and less discomfort to the patients. And quite honestly, it's a whole lot easier on my body as well. But besides the technique as far as the adjustments and using the instrument, it's the analysis. And I think that's really the big difference that Activator has. There's a very set system that we use to analyze the spine and the extremities to find where the problems are. And we use a variety of different movements where we're stressing the joints in different ways and looking for changes in the body. If we see the appropriate change when we stress an area, that tells us where the problems are. And it tells me where to adjust, when to adjust them, when not to adjust them, and after I've done it. Rather than wondering, did I hear something crack or pop? I can go back and do a post check and see that I actually affected the change that I wanted to. So it gives me good ways to measure what I'm doing and tell me where to do things, when not to do them, et cetera. And that's as opposed to, like you said, the more traditional chiropractic. It's manual. When you're doing it, typically most manual techniques are higher force, and there's cracking and popping that comes out of the spine, which is the cavitation. It's a gas bubble in the joints that you hear when we do it that way.
So, tell me a little bit. How are you aging successfully? You're obviously older than me because you said you've been out of school for 37 years. You can't possibly be the same age as me.
Well, actually, we are the same age. I'm not sure when your birthday is exactly, but we're pretty darn close. As far as how I'm aging successfully, I think the biggest thing I've done is just keep moving. And I do that with regular exercise, Um, I also, I keep moving by getting regular chiropractic adjustments. I personally, since I started chiropractic care 37 years ago, I've never gone more than 4 weeks without seeing my chiropractor. It's just what I do to keep my body functioning the best I can. You know, Otherwise, when it comes to diet, that sort of stuff, I don't have a strict dietary plan. I try to eat relatively healthy. I'm a big fan of moderation. There's a lot of things I do that may not necessarily be the healthiest for me, but they make me happy. So I believe
Yeah.
keep I got to feed my body, but I got to feed my soul too. If I just eat organic granola all the time, it might be really good for me, but it tastes like cardboard. Sometimes you need some fat, sugar, and salt in there too, but just don't overdo it.
Yeah. There's definitely something to be said for that balance in life, that it outweighs an overly strict, lifestyle.
Yeah.
I think, and part of, this whole podcast and, what I've blogged in the past is what I call well-centered fitness, which is the spiritual, physical, intellectual, emotional, and social.
Mm-hmm.
And, you can focus too much on one of those areas and it's going to throw everything off.
Right.
If you want to eat something that we would think to be a little bit more decadent, it should be something really good. It's like,
Right.
have your sweets, have your alcohol, do the things that you want, but make sure that it's worthwhile and that it's not in extreme.
Yeah.
Yeah.
I agree completely.
Eh,
And like I say, I mean, you got to have a little fun along the way, but don't overdo it on the fun, but don't overdo it on the, like you say, being too restrictive to the point that, the
Yeah.
emotional, the spiritual, the other sides of things, you're not having, you're not getting what you need on that side.
And you run marathons too, don't you? You
I
still
do.
doing that?
I haven't for the last couple of years, but signed up for next one's going to be Chicago next fall.
Right.
And not sure if we're going to throw another one in between now and then or not. But I've done, I think, 13 so far. And so going to
Nice.
have at least one
That's
more. And Chicago may be the last one, though.
I discussed my epigenetics test with True Diagnostic co-founder Hannah Wendt in episode 162. Epigenetic testing measures baseline and changes in your pace of aging, giving you the power to steer your anti-aging or health and wellness journey in the right direction. I learned that I am aging well. Click on the affiliate link in the episode description, use the promo code AGEWELL, and receive a 12% discount on your epigenetics test and monitor your pace of aging. Well, that's 13 more than I've done, so good for you. I just never quite got into it. I attempted to do I was going to do the Pittsburgh Marathon years ago, right after grad
Uh-huh.
school, and I jumped into a training regimen with some friends of mine a little bit too aggressively,
Mm-hmm.
and we went out on I think it was a 21-mile run, and I kept up with them pretty well. They were going about a 7.5-minute pace. Kept up with that until about the 16th mile. And all of a sudden, it just felt like somebody had taken the femur out of the acetabulum, rubbed sandpaper on the head, and put it back in. And I was in pain for days.
Yeah.
And at that point, I realized I just don't have the body type for marathons. Maybe I should focus on something else.
Yeah.
So I still try and do the cardio.
Uh-huh. Yeah. Marathoning is definitely, it's not for everybody. Yeah, I did. I did my first marathon and took a 5-year break in between because after one, I said, "This is stupid. I'm not doing it anymore," and
Yeah.
ended up falling in with a group of friends who were runners, and we'd get together on Saturday mornings and do our long run, which would be somewhere between 10 and 20 miles, depending on where people were on their training plans. And I was running with them and having a good time, and they were all preparing for a fall marathon. And I happened to look at a training plan for the Des Moines, Iowa marathon, and we were going to run a 15-mile race one weekend. And the prescribed training plan said that weekend you're supposed to do a 15-mile run. I thought, well, If I do the 15 and I feel okay, I'll sign up for the marathon. I got through the 15 and said, all right, this was kind of fun. I guess I'll do it. And after that, I just kept going. But it's definitely it's hard on the body, and it's a grind. Race day is not so bad. It's the 3 to 4 months that you put into the training part is where the real challenge is, and that's why I say this next one may be the last one. I'm tired of the grind. Yes.
Well, that's one thing people don't realize when we start thinking about exercise, that we think it's got to be to the extreme. We want to exercise and train like athletes. And, I have issues with fitness trainers. We train you as an athlete. It's like athletes beat the crap out of their bodies.
Yeah.
And, I don't know if you remember Kenneth Cooper, the father of modern aerobics, has well, I don't know if he's still alive, but he had the Cooper Clinic down in Dallas for aerobic research. But he once said, if you're running for more than 30 minutes, you're doing it for more than your health. Mm-hmm. And there's a certain truth to that. I think, we want to do enough to keep ourselves healthy. If we go beyond that, then we're training for something specific, which isn't bad, but it's going to have its toll on our bodies. And that's when we need to see chiropractors, right?
Yeah, exactly. That's, when I'm training for a marathon, the frequency of my chiropractic care increases the closer we get to race day.
I can imagine.
I know I'm beating myself up. So
I'm going to have to, you're inspiring me to schedule an appointment this week with my chiropractor.
Good.
It's been a little too long. I need to go once a month, like you're saying.
Uh-huh.
And so that kind of brings me to my next question is, what recommendations do you have for somebody that is seeking chiropractic care?
I think probably the best recommendation I could give anyone is ask the people you know in your community who they go to and if they're happy. Getting a personal recommendation, I think, is probably the best way to find someone. Anybody can pay for a great looking website. Anybody can pay for great advertising, but it doesn't mean they have clinical skills or are a good chiropractor. But if you know people and you get a consistent recommendation, hey, Dr. So-and-so is a great chiropractor, you're probably going to find an office that's going to be a good place to go to. So that is definitely the number one thing. It's just, asking around to see who are the people in your community, who are your friends going to. And if there's one name that's sticking out above all the others, that's probably a good choice.
That's good advice. I know I've tried many different chiropractors over my lifetime, and some have been really good, some have been really bad. I've gone pretty much by recommendations each time, but they haven't always been the best fit. Some have been great. We were talking earlier before we started the interview about our family friend when I was in high school that treated me through high school and college. It was a really great relationship with that chiropractor. I went to one when I lived in New York when I was doing some construction work and had a really bad back issue. And the guy was so arrogant, and he's throwing big words at me and trying to sell me supplements. And once he found out that I had a master's degree in exercise physiology and all the kind of showy terminology he was using, he just kind of fell apart. He wasn't that good. He couldn't sell himself too well. And he was trying to sell me on, far more practice than I knew my body really needed. Mm-hmm. But then I went to one when I, first got out of my PhD program. She was phenomenal. I was going to her really regularly, just really good about knowing what's going on in my body. Uh-huh. And the current chiropractors I have right now are pretty good as well. So I agree with you there. You want to just get those recommendations, try them out, and make sure you're comfortable with going to the person, and don't just keep going because they either tell you to go or because you don't know where else to go. Because there's a lot of really good chiropractors, and most of you are somewhat trained at the same places and same level of training. Mm-hmm. So chiropractic there's not a huge difference amongst you, but the big difference is who you are and how you relate to the customer, to the patient, is kind of my perception of it. I might be wrong there, but
Well, I would agree with you on that a lot. That, yeah, a lot of it is it's personality because the nature of chiropractic care. We tend to see people, particularly when a new patient comes in with a new and acute problem, you see them on a more frequent basis. And if you don't mesh personality wise, it's probably not going to be a good fit for you. I mean, some people say, hey, great chiropractor, but I hate them. But if they're getting the job done, but if you're going to see someone, perhaps a few times a week initially, it's nice if you can have a good personal relationship, on things. So I agree with you on the feeling comfortable on things. But also you talk about the training and that sort of stuff. There's a huge difference in what's getting done out there under the banner of chiropractic. Um, there's about 200 different chiropractic techniques,
oh
and
wow.
there's a lot of overlap between many of them, and so you can't always tell the difference between one versus the other. But different techniques work better with different patients, and obviously, some chiropractors are better at some techniques than they are with others. So I think it's good finding somebody who specializes in a technique or maybe one or two techniques, as opposed to someone who says they specialize in 15 different things. Because if you're doing 15 different things, the reality is you don't specialize in anything, and likely aren't going to be as competent at all those. So I think, at least from my perspective, I like to keep the keep the focus of my chiropractic practice on doing chiropractic adjustments, and that's all I do. I'm not trying to, like you said, the guy you saw in New York. I'm not selling lots of supplements. I have a few supplements that I have for patients, but they're the ones that I happen to take also, and so I offer those to patients. I'm not doing lots of physical therapy, acupuncture, weight loss. Having this big long list of things to do. I like that, and keep it simple, but be really good at what I do
Mm-hmm.
do. And there's other people who do other things that they're really good at. Okay, go see the other person. If you want something else done, go find someone who's really good at it, and then let them specialize in what they specialize in.
That's good. That was informative because I hadn't realized that there were that many different techniques, and I was kind of a bit more under an impression that there were fewer schools of thought. Like I believe you went to one of the Palmer schools,
Yeah, I went to Palmer in
correct?
Davenport, Iowa.
Okay, yeah. So, well, that's good to know as well. Um, so, my last question was kind of what products and services do you offer? Obviously, you offer chiropractic, and you kind of mentioned, very few supplements. So you're very, for those in your area, uh, you have, just kind of a strict practice,
Yeah,
and you know, I'd say pretty much no frills. You're going to come in, you're going to heal what's wrong with them, and take care of them. But obviously, hopefully all of the listeners, the plethora of listeners we're going to have on this podcast aren't in your general area, but those that are in proximity to your practice, how can they find you?
probably the easiest way is just go to my office website, which is simply it's just dunnchiropractic.com. You can also give the office a call at 704-964-5496. But I'm located in the Cotswold neighborhood of Charlotte, pretty convenient to a good chunk of the population here in Charlotte, and that's probably the easiest way, though.
All right. Well, I will put that in the notes for the podcast so that anybody kind of listening can go to that and get a quick link to connect themselves with Dr. Mark Dunn. Anything final you'd like to add for my listeners as we kind of wrap up?
Yeah, yeah. I appreciate you having me on, and Good seeing you again. We've gone back and forth some through messaging and stuff the last few years since we reconnected. So it's good to actually see your face and hear you again after 30 whatever years now.
You likewise. Well, hope to keep talking to you and hearing good success about your business, and keep seeing you aging well.
All right. Thank you.
Thank you for listening. I hope you benefited from today's podcast, and until next time, keep aging well. If you have topics you would like to have us discuss on the Aging Well podcast, please click on the links in the episode description to send us a text or record your message or comments. We'd love to hear from you and how we can help you age well. If you benefit from the Aging Well podcast and would like to support the content financially, please click on the Support the Show link or support our affiliates and advertisers.